is World Alzheimer's Month, so today we're talking about recent research and common myths regarding the disease. Joining us now is the author of a new book called The End of Alzheimer's Program, Dr. Bredesen. He's also Chief Science Officer for Cognitive Health Centers. Thank you so much for being here, and thank you for what you do, by the way.
Thank you, Dina.
I want to talk about, there have been some advancements recently. We've got a new drug that's been approved, and we've got a new law here in Illinois to help doctors be able to learn the signs so that they can spot the signs of Alzheimer's in their patients. But really, I think we still need to educate more and more people because this is a disease that is more commonly being diagnosed.
Absolutely, and in younger people, of course. When I was training way back in the 1980s, we would never see people who were in their early 50s, for example. And so now this is one of the most common things that we see. And the other thing that we know now that we didn't know years ago is that this actually begins about 20 years. The changes in your brain begin about 20 years before a diagnosis of Alzheimer's. So what we used to think of as a disease of the 60s, 70s, and 80s is really a disease of your 40s, 50s, and 60s, which simply gets diagnosed much later and actually can have changes into your 30s. So we recommend everybody, just as you get a colonoscopy when you turn 50, please get a cognoscopy when you turn, if you're 45 or older, please get a cognoscopy so that you'll know where you stand and you'll know what your risks are for developing Alzheimer's.
And I know that some of those tests are even online. I mean, there are certain things that we can look for. So the myth, of course, the first myth that you want to talk about is the fact that only older people get Alzheimer's. What should people in their 30s, 40s, and 50s be looking for to say, I may be really at risk?
Yeah, great point. You know, and very many of the risk factors are the same as those for the pandemic. So if you have hypertension, obesity, low vitamin D, low zinc, metabolic syndrome, insulin resistance, type 2 diabetes, these are all risk factors for COVID-19. They're all risk factors for Alzheimer's disease as well. And so people should be looking for those things. And again, get evaluated. You can have some simple blood tests. An online cognitive assessment, as you said, you can do this part online. And then if you're symptomatic already, please don't wait. This is one of the biggest problems. There's this thing we call mild cognitive impairment, which is actually the third of 4 stages of Alzheimer's. So please don't wait until too late. If everybody were to get on prevention or the earliest reversal, and we've just had work come out with 7 people who wrote their own stories, called The First Survivors of Alzheimer's, wrote their own stories about their own improvement. If people were to do that, we could really reduce the global burden of dementia.
And that's something I would love to talk about, this idea of prevention. And in order to do that, we need to talk about the lifestyle changes that may contribute to dementia and perhaps Alzheimer's. We know the disease is hereditary, so some people are at greater risk, but others, just by virtue of what they're doing in their lives, could be raising their risk.
That's a great point. And, you know, familial Alzheimer's is only about 5% of all Alzheimer's, where it tracks for every generation of the family. So for the 95% of us, it is sporadic. And you're absolutely right. There are many things we can do, beginning with an appropriate diet. Diet turns out to be a big player in Alzheimer's, not something that was taught in medical school years ago. And so getting appropriate, low-carb, really high, good fats, making sure that you're not insulin resistant. So the same things that will prevent you from developing type 2 diabetes will also help to reduce your risk for Alzheimer's disease. And then, interestingly, exercise. Again, each of these things by themselves, not a cure. But when you put the entire program together, you have appropriate exercise, and people are using things like Katsu bands now, for example, to enhance the exercise quality. Both the aerobic and strength training, very, very helpful. And one of the things it does, for example, is to reduce that insulin resistance. And then getting good sleep. People with sleep apnea are at increased risk for dementia. So everybody should know whether they're dropping their oxygen status at night. Easy to find out. You can do it through a wearable, or you can do it through a little oximeter, very inexpensive. You can have your doctor loan this to you for a couple of days. Just check your oxygenation at night. Make sure you're not dropping into the low 80s or even below that, because this will increase your risk for dementia. You can address that and improve your outcome. And then stress. It's amazing how important stress is for development of Alzheimer's. We have some of the patients actually who do well until they get under stress, and then they don't do as well, and they do better when their stress is removed. And again, there are many things that can be done about that. Brain training, another one, very helpful. And then finding out if you have various toxins, so biotoxins, inorganic toxins, organic toxins, these are all important. And certainly we just all looked at the 20th and memorialized the 20th anniversary of the World Trade Center. The people who were the first responders, about 15% of them now have cognitive decline because of that exposure to that toxic atmosphere. So it is absolutely a player in cognitive decline. And so there are many things that you can do. And the surprise is that this disease can now be a relatively rare disease if we simply know what to look for, if we get on appropriate prevention or early reversal.
And that is what is so important about your message, that you can make a difference. I love that you have the stories of people who pulled themselves back from this to slow the disease. Doctor, thank you so much.
Thank you, Dina.
If you at home want more information, you can check out Facebook, Twitter, or cognitivehealthcenters.com.